So, for those of you who I've not met yet, my name is Sandra Abrevaya, and I am the co-founder and CEO of Synapticure. And my brother-in-law, Peter Wallach, and my husband, Brian Wallach, who's been living with ALS for 8 years, started Synapticure because we wanted to provide really high caliber care to families across the country who were living with ALS and other neurodegenerative diseases. So we knew that it's really hard to get an appointment with a neurologist. It's hard once the disease starts to progress to be able to travel to appointments. And so we thought, how can we build an essentially a clinic, an ALS clinic, and then we expanded to other disease states that reaches people in their homes. And so Synapticure sees patients in all 50 states, and we have expert ALS neurologists who you can get an appointment with within weeks, as opposed to sometimes the months long wait that families experience. And you can do it from your home. And again, speaking from our personal experience, my husband, Brian Wallach, is, 8 years into ALS and still firing on all cylinders at 100%, but he is completely paralyzed and his speech is really impaired. And so, especially for families like ours, we wanted to bring that opportunity to every state and nook and cranny in the country. And so today we're really excited to, as part of that, bring awareness to extremely exciting technology that Neuralink is driving forward with an incredible pace of change and just really revolutionary technology that is improving lives for families. And part of what we want to do at Synapticure is make sure that the families that we're connected to have information on cutting edge care. And so we see this as part of that. Some of you who are joining us today are part of the Synapticure program. Some of you are not. We're just excited generally to connect with the ALS community and have both Romina, who I'm going to turn it over to in a moment, share more about Neuralink, but also have three people living with ALS today share their own experiences. So, in using this technology specifically that Romina and her team have built. So, with that, Romina, if it makes sense to you, I would love to turn it over to you, have you introduce yourself about the company, and I believe you have a little bit of a presentation to share.
Yes, perfect. Thank you so much, Sandra. I can speak on behalf of myself and Neuralink. We're really honored to have this opportunity to partner with Synapticure and share our technology and share our participant stories with you as well today. So I'm going to get started here with the presentation. All right, awesome. So my name is Romina Nejad. I'm the clinical trials lead here at Neuralink. I've been working at Neuralink for 4 years now. Started back before we had any FDA approvals or regulatory approvals in general to launch and test our brain-computer interface in clinical trials. And today I'm just going to go over a very brief kind of overview of our technology and our clinical trials, and then give time for 3 of our study participants to present their stories. We have Brad on the call, we have Jake, and we also have Nick. All right, so our mission at Neuralink is to create a generalized brain-computer interface to restore autonomy to those with unmet medical needs today and unlock human potential tomorrow. Everything that we experience, as humans and in the world, through vision, through processing movement, speech, comes through neuronal firing in the brain. And so our goal at Neuralink is to create a brain-computer interface, which is an implantable device that is implanted within the brain to help directly access those neurons in different areas of the brain and essentially restore autonomy through different outputs. In order to do that, we have a technology stack that we've developed and vertically integrated through Neuralink in general. We have a fully implanted device with over 1,000 electrodes that we call the N1 implant. You can see it on the far left panel here. And you can see here we have 128 thread devices. Each one of those flexible thread arrays are implanted in the brain and contain a number of different electrodes, depending on which version of the device you've received. So Brad has the 64 thread device, whereas Nick and Jake have the 128 thread device. And essentially, to implant this brain implant into the brain, we require a surgical robot that essentially grasps each one of those threads, which is thinner than a human hair. The most skilled neurosurgeon in the world will not be able to manipulate each one of those threads, just given their sheer flexibility and size. And so we have this R1 robot that works with the neurosurgeon to implant those threads within the human brain. And once the device is implanted, it records and decodes neural activity from specific brain areas, and it translates it into either a digital output or a physical output. In the case of the studies that we have, which I'll go into more detail, I'll outline what those outputs are. But here I have, a WebGrid game, which is essentially the device decoding neural activity for cursor control. So it's recording neural activity and movement intention to move the cursor and click on those boxes within this WebGrid game that you're seeing here. A little bit about the surgical robot here. As I mentioned, we have a neurosurgeon in the room that works with the robot. The robot goes in and grasps each one of those threads that contains electrodes along it, and it peels it off the implant mechanism and implants it into the human brain. So you can see here, once the threads are inserted, that's how essentially it looks within the cortex. You can see very minimal bleeding. The robot has vessel avoidance technology that inserts the threads in areas to prevent, puncture of micro blood vessels within the brain. It also has very sophisticated laser technology that coordinates the insertion of the threads in conjunction with human breathing and brain pulsing parameters. And so the entire surgery can take anywhere from 3 to 6 hours, depending on, all different aspects of it. But essentially, once the neurosurgeon conducts the skin incision and opens the brain, then we have the robot that comes in, does the thread insertions, and then the neurosurgeon closes it back. And the implant itself is completely wireless, so you don't have any cords or any open ports or anything like that. And then you are essentially discharged from the hospital within a couple days, and then can go home and rest before you start using the technology in the comfort of your own home. As I mentioned, our goal is to create a brain-computer interface, and the primary, function of a brain-computer interface is to translate that neural activity into useful actions for the users. So here, how the schematic works is that we have this wireless brain implant with over 1,000 electrodes. It's inserted specifically next to motor neurons within the motor cortex of the brain. Those electrodes decode the neural firing patterns of those brain cells. And then we have a decoding algorithm that essentially truncates and condenses that activity into useful outputs that's wirelessly transmitted to an app on a computer, which then allows you to control the cursor, allows you to connect to an external robotic arm and use the robotic arm for useful tasks such as microwaving your food, opening a fridge door, that kind of thing. And so this is overarching overview of kind of what we're doing here at Neuralink through our various clinical trials. This is a video I'd like to share just to show how participants are using the device. So this is our first participant, Nolan. He was the first Neuralink implant user. We have Brad. You can use the device to play video games. And then I'll let, of course, the participants go in more detail on how they use the devices. Currently at Neuralink, we have clinical research areas that we're focusing on for device control, speech restoration, and upcoming is vision restoration. So for device control, we have the PRIME study, which is also launched in Canada, Great Britain, and the United Arab Emirates as well. We also have the use of cross-enrolling from the PRIME study into the Convoy trial, which would allow you to use the Neuralink implant to control the robotic arm. We have clinical trials in various different states and locations, and they're all actively enrolling for the PRIME study at the moment. For speech restoration, we just launched this in October. We haven't publicly announced this yet, but the speech trial is up and running at University of Texas Southwestern in Dallas. And we also have the ability to use the device for speech restoration in the United Arab Emirates as well. And then upcoming, we have the blind sight device that we're using, which is a slightly different device that would be inserted in deeper areas of the brain. It has decoding, so reading from the brain as well as stimulating information back into the brain in hopes of providing visual restoration in individuals with blindness. And for the PRIME and voice trials, we are enrolling participants who have severe motor or speech impairments due to ALS, spinal cord injury, or other neurological conditions such as stroke, motor neuron disease, etc. So in the US specifically, we have 3 feasibility studies. We have PRIME, Convoy, Voice. As I mentioned, each trial has a different objective. So for PRIME, we're controlling digital devices such as computers, phones, keyboards, with your thoughts. We do have this on clinicaltrials.gov if you're interested in looking at the eligibility criteria and learning where our clinical trial sites are. But we do have sites in Arizona as well as Florida. For Convoy, we cross-enroll from the PRIME study, and so through Convoy, participants have the ability to use their N1 implant to control physical devices, such as the ARA, the assistive robotic arm, or their wheelchair using their thoughts, so it just provides a layer outside of digital control. And then for the voice, which is our newly launched trial, we're translating thought into speech through text or through vocal outputs through a computer, not through actual restoration of the speech through the person, but through digital means. And then because these are all 3 of these trials are early feasibility studies, the main objective of an early feasibility study is to test the initial safety of the devices themselves and the procedure. So our primary outcome measures for these trials are safety. And of course, our secondary and exploratory endpoints are to receive as much feedback as we can from our participants so that we can continue to improve the device before we lock down the device design for a more efficacious based trial, such as a pivotal in the near future. And then as of September 2025, we've 12 humans implanted using a Neuralink across Canada, US, and yesterday we announced our first UK participant as well. So we're 13 with that. We have over 2,000 implanted human days cumulatively, taking all 13 participants, and 15,000 hours of independent device use across all of our participants to date. And with
Romina,
yeah,
question for you. So there are 12 humans using Neuralink, and
yeah,
3 of them are here on this call today.
that's right. Yeah.
Wow. That's amazing.
Yeah, I'm really excited to have them on. I'm thankful for them, volunteering their time to do this and share their experiences.
Incredible.
And that's pretty much it from me. If you're interested to learn more about Neuralink clinical trials, you can visit neuralink.com/trials. We have an overview of our current trials, upcoming trials. You can also join our patient registry, which would allow you, anyone on the call to interface with Neuralink directly. We can answer any questions you have, determine preliminary eligibility for trials. And so that's a very useful link if you want to learn more. And with that, I'm going to move over to our participant stories. We have Brad on the call. He is the first ALS participant we've ever enrolled in Neuralink and actually has his 12-month visit coming up next week, which is a big milestone. So I'm really happy to have Brad here. He did prepare this video that I'm going to share in the next slide. And so just let me know if you guys have the audio as well when I play it.
Ladies and gentlemen, fellow warriors living with ALS, and the incredible caregivers who stand by our sides every day, thank you for being here. My name is Brad Smith, and I'm honored to speak with you today. You might know me as the third person in the world to receive a Neuralink brain implant, the first with ALS, and the first who's nonverbal. I am also known as ALS Cyborg on X. I type this speech using just my thoughts, straight from my brain to the computer. Isn't that wild? If you're like me, you've probably dreamed of a day when technology could give us back some of what ALS has taken. Well, I'm here to tell you that day is here, and it's getting brighter. Let me start by sharing a bit about my journey because I know many of you are walking a similar path. 7 years ago, ALS hit me like a bad driver in a Phoenix parking lot. It stole my ability to move, speak, and even type without exhausting effort. I relied on eye gaze technology, which was a lifeline but trapped me in dark rooms, away from the sun, and made communication feel like texting on a flip phone from 2002. Thoughts piled up in my head. Dad jokes, ideas, words for my wife Tiffany and our kids Lincoln, Edison, and Abigail. But getting them out was painfully slow. I felt stuck, like driving a car with a steering wheel made of jello. Then Neuralink entered the picture. I'd been following Elon Musk's companies for years, but after my diagnosis, Neuralink became my beacon of hope. When the patient registry opened, I jumped on it, lobbying shamelessly through their portal. In November 2024, at Barrow Neurological Institute in Phoenix, I became patient 3. The surgery was a breeze for me. I napped while the geniuses did their work. They implanted a device the size of a stack of quarters in my skull, with 64 threads and 1,024 electrodes in my motor cortex, listening to my brain signals. There were no real problems or pain from the surgery itself. It was straightforward. And the team at Barrow Neurological Institute is amazing. I had no fear of the surgery. Recovery had its rough moments, but not for any medical issues, synthetic narcotics, and I had a fling I don't recommend, knocking me out for a couple of days. I spent just 24 hours in the hospital for observation, and by day 3, I felt normal again. Staples came out after a week, and I was cleared to start training shortly after. No lingering pain, no complications, just excitement to get started. From what I've heard from other patients, this is typical. A short, manageable, painless recovery that gets you back to life faster than you'd expect. Now let's talk about what Neuralink actually is, because understanding it is key to seeing its potential for all of us. Neuralink is a brain-computer interface, a tiny implant that reads your brain's electrical signals and translates them into actions on a device, like moving a cursor or clicking. Imagine your brain as a stadium full of cheering fans, your neurons firing, and the implant as a super-sensitive microphone picking up those cheers. It processes about 16,384 variables 66 times a second. That's a fire hose of data. The implant filters it, sends the key spikes via Bluetooth to a computer, like a MacBook Pro, and AI models decode your intent into movement. To bring this to life, let me show you. As you can see, my Neuralink implant is a coin-sized device with 64 ultra-thin threads radiating outward, each thread dotted with electrodes totaling 1,024. More recent pioneers have received 128 threads, and I am just a bit jealous. The demo animates these threads inserting into the brain tissue by a hyper-accurate robot. I have seen a picture of my brain with the threads in it, and it looks completely clean with no bleeding. The robot is so accurate that it can see the blood vessels in the brain and avoid them. This visual shows real-time neural activity as lines of white bars spiking, like a dynamic equalizer, lighting up in patterns when I think about moving my hand. I can't see the patterns, but the computer can through machine learning and artificial intelligence. Those spikes get mapped to a cursor on screen. Early on, my cursor was a drunk mouse, stumbling around, but with training, those signals sharpened. And now, it's smooth as riding a bike. It's not magic. It's science decoding the brain's weird, wonderful ways. For us with ALS, where motor neurons fade but the brain's intent remains, this bridges the gap beautifully. Let me demonstrate how it works. I'll walk you through it because once you see it in action, you'll get why I'm so excited. First, the basics. Neuralink does not read my thoughts or deepest secrets. To be honest with you, I don't have a lot of secrets. The implant only reads my intentions to move my body, and it translates those into commands from my computer. To move the cursor, I just think about moving my left hand, the area where the implant sits. No physical movement needed. It's pure intention. We use colored targets, blue for left click, jaw clench, yellow for no click. The AI learns from that, getting smarter each time. One of my favorite features is the AI chat app, something I pitched to Neuralink a year ago, and they built it. It listens to conversations around you, uses AI like Grok to suggest responses, and speaks them in your cloned voice. Testing it with my parents was hilarious. They called it HAL 9000, and it sassed back. Now it's got my personality. Witty, a bit sassy, and getting faster. And gaming? Oh man, they brought a Nintendo Switch to my house. I steer with my brain. Left and right, thoughts control the cart. I beat my son Lincoln once. Edison let me win. Abigail claims she's undefeated. But playing Mario Kart with my kids? ALS took that away. Neuralink gave it back. And travel? Before, it was impossible. Now, I've been to Utah twice. Fremont for Neuralink HQ, all in a shuttle bus because I'm high maintenance. Texting from the porch in the Arizona sun, editing videos on my MacBook, presenting to church groups. All possible now. Look, I know ALS sucks. It's slow, incessant, and unfair. But Neuralink has given me hope, freedom, and joy I thought were gone. I'm happier, despite ALS, closer to Tiffany, literally and figuratively, and a dad who plays games again. As I shared on X, you can follow me at ALS Cyborg. I was able to watch fireworks on the 4th of July with my family in Utah. ALS had stolen that family moment. Neuralink gave it back. My outlook is brighter. I've gone from a drunk mouse to typing faster than eye gaze with fewer mistakes. It's empowered me to text outside, control devices, and dream big, like driving my wheelchair or editing videos with drag and drop. If you're living with ALS, I encourage you, sign up for Neuralink trials at Neuralink.com.
All right, thank you, Brad. That was a beautiful video, and I'm very thankful to you for putting that together to share with everyone today.
Thanks, Romina and Brad. Wow, it is an amazing video. For those of you who have just joined us or joined us after we started, we just heard from Brad Smith. He's the first ALS patient to use Neuralink, one of the first to use Neuralink at all, and he was able to share his experience. And a couple of months ago, Brian and I had the chance to.
Inconceivable!
Yes, is that the AI function, Brad? We Brian, my husband, who's been living with ALS for 8 years and also is paralyzed and has a lot of difficulty using eye gaze. We wanted to learn more. And Brad and his wife Tiffany, who I think Tiffany are by Brad's side, just like so generously, yes, made time for us and answered questions we had and showed us how Brad uses it. And so before I turn it over to our other participants to share as well, I just wanted to say a huge thank you to Brad and Tiffany for continuing to time and time again share this incredible opening that, Neuralink has provided to such a higher quality of life for you both. I
Thank you.
feel what you've shared so deeply. We have 8 and 10-year-old daughters, and the way you're able to play video games with your kids
Yes.
and interact. Wow. That's really something. So we will come back to you, Brad. We're now going to take some
Ladies and
time
gentlemen, fellow
to
Sorry.
meet all good to meet Jake next. And Jake, obviously, just this is really interesting to be able to hear from you. I think you share publicly, you're in your 30s, you were diagnosed in 2022, and you received the implant for Neuralink in June of 2025. And so just over to you, sharing really your personal story, and we'll ask a bunch of questions as we get into this. But at the beginning, just really, if you could let us know sort of what interested you, what drove you to explore Neuralink.
Yeah, thank you. My name's Jake Schneider. I'm 35 and I live in Austin, Texas. I was diagnosed with ALS in February of 22, so just over 3 years now. And like you said, I got the Neuralink implant of June of this year. So I was patient number 7 to have the implant. Um, the things for me when my ALS symptoms started, the things that started to fade away first were my shoulders. So, weight bearing became a problem. And then that eventually spreads to your hands. So, you can no longer type, you can no longer fumble with your cell phone. And I was a very high functioning, individual. I was 31 when I was diagnosed. And so you go from having all this stuff and it's all of a sudden taken away. And I have a 6-year-old son who it's like, this, like, I can't throw the ball like other dads, like I am not able to do things that other dads can, but now like he thinks it's so cool that I can do things that other dads cannot. So for me, like discovering, living in Austin, Elon Musk, everything he does is pretty much publicized. So I knew about the program, and at first when I started reading about it, the inclusion criteria for the trial wasn't really inclusive of ALS, but I filled the form out anyways, and I have total to partial paralysis of my limbs, and can't really do anything with my arms. I can't lift anything with weight. They're pretty much just dead weight that hang at my side. So I filled that out, and 6 months later, the clinical trial team and the folks at Barrow started contacting me. So I had my procedure at Barrow, much like Brad did in Phoenix, Arizona. Um, and my trajectory of recovery was the same. But what made me really interested in Neuralink is that for the ALS community, medically, it doesn't seem like we're closer to a cure today than we have been, in 50 years. So it's like, at some point you have to start finding other options and other ways to make your life better. And if I could help pioneer technology that is going to help, millions of people down the road, then, the risks are definitely worth it. And I just, in the short time that I've had it, I'm pretty much connected to this all day long. Um, I can do so many things on here now that before, I was fumbling the mouse around, pushing it around with 2 hands, one finger typing. Now I'm helping Neuralink develop a program called 10 finger typing, which I can show my screen briefly, and show you what this looks like. Um, if you imagine that looking at this keyboard, what I do there is I calibrate through loads of data to imagine these different motions and movements to attempt to type these keys. So before, I would voice dictate a lot of things, but that gets difficult if, other people are in the room and it starts picking up on things. And then, so this is clearly going to pick up what I'm intending to type. And in the trials that we've been doing it, as we've been testing it, I've been able to move at a speed of 141 words a minute. So it can keep up, very well. And I'm in the process of using this to help me write a book about my experience and my journey. So it's like, like Brad said, ALS hits you like a pound of bricks, but like having this opportunity, like for my generation, is like the equivalent to being one of the first ones on the moon. So it's like, I owed it to myself. I owed it to my son to, take a chance. And now, he thinks I'm a superhero with a computer chip in his head, and it's been like a gift from God. So that's all I really have to share with you guys. I appreciate you listening to my story, and thank you for having me.
Thank you so much, Jake. I love how you said that you went from sort of feeling like there were things you couldn't do with your kid, like throwing a ball, to being able to do things that other dads couldn't do. Um, are you listening, Brian Wallach? So, I'm just giving my husband sass, as we both learn so much about just the incredible things that are possible and that you all have accomplished with using Neuralink. So we'll come back to you, Jake. Thank you so much for sharing. Um, Nick, we're gonna turn to you next. Um, I think you've also pretty recently started to use Neuralink, and have been living with ALS for about 3.5 years. And, would love to hear what brought you to wanting to test this technology and work with the company, and just generally, if you could share your personal story and background and how it led to this moment.
Yeah, thank you very much. Um, I was diagnosed a month before Jake was, in January in 22. And part of living with ALS every day is losing something new every day. And sometimes it's something small and sometimes it's something big. And but it often does feel like a slog towards losing everything. And that's not a great place to be mentally or physically, frankly. Um, so my interest in Neuralink was self-serving and idealistic, and the opportunity was so massive to be able to, whether I woke up from surgery with the chip working or not, it was going to be the first time in years that I was for really, real useful. Like, we're going to find out why this chip didn't work, or we're going to find out all of the things that we can do with this chip and see what the limits of this thing are. And regardless, it was the opportunity to have to feel like I had a purpose in ways that I had lost for a few years. Um, so that was my primary interest in it. I did not know about it. My dad sent me a text message after my aunt sent him a text message saying, "Hey, I saw this post about this guy named Brad Smith, and he has ALS too. And Nick has ALS. He should try and do this. I think Neuralink might be right up his alley." And so I went ahead and threw my hat in the ring, and it turned out to be absolutely worth it. Um, all three of us were lucky enough to wake up and have a fully functioning BCI, which is, for all of you who are familiar with ALS, you lose things and you get really good at adjusting to this thing is gone now and you're not going to get it back. That's just, it is what it is. And you become not comfortable with, but accustomed to. Um, losing things that you are never going to get back. And so gaining functionality that I thought was gone forever was so incredibly life-changing. Before Neuralink, I was a photographer and a drummer and a graphic designer, and losing all of those things to ALS, and then getting so far a handful of them back and maybe more. We'll see about drumming. But when you getting things back gives you an excitement up for tomorrow that you don't generally have with ALS. It's a difficult thing to cultivate. I thought I was doing a pretty okay job of it. Before the Neuralink, I was doing pretty good. And then with the Neuralink, the anticipation of what am I going to do? What am I going to do next? Is, to me, that was the biggest thing Neuralink gave me. It also gave me a lot of digital autonomy and a little bit of functional autonomy. Not a lot, because they took the robot arm with them. So I don't still have it, but I am going to, let me see if I can do this real quick. Stop listening, Mac. Okay, stop listening. There we go. I'm gonna share that one. Share. Okay, so this is the video of me with the oh,
And you're moving this arm with your thoughts.
yes. This is it, gesturing, just gesturing. I'll be able to talk with my hands again. So right, for me, that was the pinnacle. Like I fed myself a chicken nugget. I took a sip out of that cup. I microwaved the chicken nugget before I ate it using that robot arm. But for me, picking up that cup and gesturing while I was talking, the thoughts at that point were not forward, up, down, back. The thoughts were, I'm holding a cup and I'm gesturing the same way I would if I was standing up to give a speech at a wedding. It was incredible to be able to just gesture with an arm again. It wasn't mine, but I was controlling it like it was. And the latency was so low that it truly felt like an extension of me by day 3. And that, moving forward with those kind of projects, I think those things are going to give people levels of independence that they thought were gone forever. Thank you very much.
Nick, I love how you talk about like it's not just up, down, left and right anymore. It's almost like ALS flattens our world, and this is like bringing you back into like the three-dimensional version of existence again. Um,
Yeah.
Unbelievable. I wanted to mention I have some questions for the amazing participants that I'll ask, but we have almost 100 people with us today. And I wanted to ask if you do have questions that you wanted me to ask, if you could put them in the chat, and we'll try to get to several of them, time permitting. So, one question that I wanted to be sure to ask while we wait to see what questions the community has is, you know, what do you think is misunderstood about the technology, that, you want to make sure people realize is one way, as opposed to maybe like an assumption that folks might make, given, I mean, just, I think, Jake, you might have said it. This is like, this is like going to the moon. You guys are the first 3 out of 12 people to go to the moon. It's amazing. And so, what do you want to tell us about the moon that we assumed was one way, but is another?
Well, I think probably that the biggest misconception that I received when I talked to people and told them that I was getting the Neuralink implant, I think a lot of people assume that it's going to give you your physical functionality back. Like, does this mean you're going to be able to lift stuff again? Well, no, I wish that was the case, but it gives you the ability to interact with technology and communicate with people. That communication is probably the hardest thing about this disease, because you don't know how to, express yourself to your needs and what you need help with. So, like, the communication aspect of it is the biggest key, and using those neural thoughts to create intended movements for, hopefully, to control, life-size robots in the future.
Nick or
Yeah.
Brad and Tiffany. And I'm sorry, I always welcome the caregiver to weigh into being a caregiver.
Uh, for me, some of the biggest misconceptions are like, man, I don't know if I would be able to use a Neuralink. Like, I would end up thinking some horrible thing, and then that email would get sent, and
Mm,
that would be a problem for me. And that's not how it works. You have to. Your brain is not automatically sending emails on your behalf. The robot arm is not going to accidentally swing out and smack somebody because they slighted you a week ago or whatever, like your negative thoughts or intrusive thoughts or whatever don't have anything to do with this. It's all in your motor cortex. And another big one that I have seen a lot is that Neuralink, now with the power of Grok 5 and XAI, or look at all this stuff they're doing for Neuralink, and their Grok and XAI are incredible companies,
Yeah.
and I don't think we need to conflate the two. Neuralink is doing all of this without the help of Grok, and Grok is doing all of that without the help of Neuralink. And yeah, I think that's an important thing to remember, that this Neuralink team is building groundbreaking technology uh, on their own.
They're
It doesn't
also not downloading our thoughts like a lot of people think
doesn't
as
read my
well.
mind.
Sorry, Matt.
It doesn't read my mind.
I think Brad's saying the same thing.
Yeah.
It doesn't read his mind. We've had a lot of people say, aren't you worried about it's going to say things that you're thinking? And it's like, it's just not how it works. It doesn't read your mind and project your thoughts.
Yeah.
It only takes from the motor cortex. Right now with this, it's these 2 studies that they're working on right now, it takes from the motor cortex, so intentions to move. And the speech study is going to be awesome. I'm so excited for the people who get to participate in the speech study, because that will just move to just a little bit different part of the brain that controls the speech motor cortex.
Yes.
And so the intention to
Yes.
move your mouth and the vocal cords, that intention, it's going to pick up that intention and be able to turn it into text that you can then either send somebody or project out loud through a computer. So I'm super excited about that for other people as well.
Awesome. And Tiffany, before we go to some of the questions that people are sharing, I did want to just ask you, you shared some beautiful things with me, kind of caregiver to caregiver, about the ways in which, from your perspective, it's improved Brad's quality of life. And so I just, if you're willing to just take a second to also share any thoughts you want to about your perspective on it with everybody here today.
Well, I don't know. I share different things all the time, but one thing that was visibly noticed was Brad just smiled more. And I think all three of them talked today. It's just you lose so much with ALS, but having possibilities be open to you and opportunities to, like, I feel like ALS takes away the opportunity for growth. And with Neuralink, all of a sudden it opens windows to growth and learning. And the kids, I mean, so many people with ALS, it's like they want to connect with the people around them, and this gives them the opportunity to connect. So whether it's with your kids or, you know, your spouse or a really good friend, like the connection is pretty awesome. And the ability to help, like Nick was saying, it's like Brad has really enjoyed having purpose and helping the Neuralink team. Just having the opportunity to help people is, you lose that, and you rely with ALS, you rely on a lot of people to help you. And then all of a sudden you're given the opportunity to really be able to help somebody again. It's pretty awesome that way. And it's awesome as a caregiver to be able to see that switch in somebody. And it's like, oh, there's some hope right there that comes out again in them that they've been missing for a while.
Yeah. And I have to say, after Tiffany and Brad and
The surgery was really easy, no pain at all. I was out the next day.
that's actually part of a question, yeah, that somebody asked in the chat. So, two questions. One is, Brad's shared that he was sort of pleasantly surprised by how smooth the surgery was. So one of the questions in the chat is,
Yes.
what was the most difficult part of the procedure? And so, as folks think about how they want to answer that, also, Romina, if you can be ready to answer the question that we also have, which is, what is the expected lifespan of the chip? Maybe when it comes to the procedure and anything you think would help the community here today, if folks want to share, come off mute and I'll turn it over to you.
I think the hardest part of the procedure for me didn't involve the procedure. It was the time leading up to it and the waiting. Like, I am known for my patience and my ability to just take things in stride, no problem, all the time. And so this was super easy for me. But yeah, it was a difficult waiting period, to say the least, when something of this magnitude, that like this opportunity is right there, and waiting to find out, like to get that phone call, congratulations, you've been selected, is, I think that was harder than any of the rest of it. It was all jelly beans by comparison.
Thank you,
Yeah,
Nick.
I think I agree with Nick. The procedure itself and the Barrow team were incredible. Um, it is just that waiting game, and I think I was blown away at how like little discomfort or pain I was in post-op, and how quickly the recovery process was, and the healing process was all very, very quick.
Thank you. And Romina, as you answer that next question about the lifespan of the chip, could you also speak to another question we have from the community, which is, how is the device powered, recharge? How long does the battery last, et cetera?
Sure. I see Nick shaking his head there. So if you feel free to explain how you guys charge and power your devices. But from our end, we have a wireless, as I mentioned, the implant's wireless. So we have an inductive charger, which is essentially the size of a little cap like this that you can place inside a hat. Oh yeah, Tiffany's showing it. There you go. And you can either place that on the head itself, or you can put, keep it at a distance away, and it will still charge the implant through inductive charging. I think Brad's device is about 4 hours of use with, I think, 30 minutes or an hour of charge. Feel free to correct me if I'm wrong there. But for the newer generation device, it's about 8 hours of use. So in the 128 thread device, we've increased the battery capacity there for 8 hours. And then, of course, you can use the device while you charge as well. So, um, yep. And it looks like maybe not everyone saw the Tiffany's showing the charging puck, but maybe if you can bring that to the camera, that'd be useful.
The feeding tube was much worse than brain surgery.
So if you've had a G tube, you're golden.
The recovery from the feeding tube was much more painful than the brain surgery.
Oh, fascinating.
So
Agreed.
Yes. Yes.
But everyone should also get a G tube when they need it.
Yeah, that's
the
I
other
want to
thing,
start with
the other thing that was really hard for Brad was the no eating for
Yeah.
several hours before, and then they want him to not eat afterwards too. That was he likes to eat, whether by feeding tube,
Yes.
any way he can get it. So
Yes.
Well, just to make sure everybody on the call is tracking, at the beginning, Romina presented
I
before
find your lack of faith disturbing.
over to the community. So we have a patient registry and community page, which has been shared. Peter Wallach just put that in the link there. Hopefully everyone can see that. And so as Romina explained, there are multiple clinical trial enrollments and opportunities current and in the coming months. Romina, do you want to just repeat that really quickly for people to hear that one more time? I know also some people joined who weren't here at the very beginning. Just a little recap of the clinical trial opportunity ahead.
Yes, so we have 3 active trials in the U.S. that are enrolling participants with ALS, spinal cord injury. We have the PRIME study, which is looking specifically at individuals with ALS who have, upper limb and lower limb to a certain extent impairment. We use a motor strength grading scale for that trial's IE criteria, eligibility criteria. So if you have, we do at the C5, C6, C7 level. So at the C5 level, which is, this kind of motion here, if you can move that against gravity with some minimum resistance, like imagine you have a spoon or some weight, if it was strapped on, if you can do that and you're non-ambulatory, you would qualify for that PRIME study. For the voice trial, we use a different grading system for the eligibility criteria, and that one is using the ALS FRS rating scale, which is more common, to people with ALS, and we have different sets of criteria for bulbar onset and limb onset ALS. For that one, the 2 main criteria is that you just need upper limb impairment, but if you can still walk and stand, you would be qualified. So the motor strength requirements for the voice study are a lot more relaxed than they are for the PRIME study. And so we have the summary of the IE criteria on our clinicaltrials.gov pages, or you can reach out to us through our patient registry link, neuralink.com/trials for more information. And then just to briefly speak to the lifespan of the device. We launched our clinical trials in 2023, but our first participant, Nolan, has had the device implanted as of January 2024. And so he's outside of 18 months and still using the device. From like human data perspective, we also have the ability to use the device throughout the entire duration of the study. So for the PRIME study, that's a 6-year trial. So as long as the device continues to work, you can continue to use it. We don't guarantee any specific time frame for that. Given that we are still in the very early stages and it is an investigational device, but we do have robust preclinical animal data as well as benchtop testing data to show device use and anticipated use beyond 5 years. And in humans, we've seen with Nolan outside of 18 months of use and continued use. And so as we continue to collect data through our clinical trials, our goal is to actually get that precise lifespan of the device.
Great. And Tiffany's
I
Zoom.
am happy to show the charger again. So this
Yes,
is
thank you.
this is the base where this is where the charge actually comes from. It plugs in through USB-C to a wall outlet, and then this holds quite a bit of battery, and then you plug the coil in. So it's pretty small, and it just rests like right over. So a lot of the participants have a ball cap that they can slip this in and just charge it that way. Brad likes, we're in Arizona, it gets hot, so sometimes it's too hot to wear a ball cap, but we have this little holder that we can just place right close by where it is. It doesn't even have to be, doesn't even have to mess up his hair. And
Brad, you have good hair.
it
Thank
holds
goodness.
right on to the power wheelchair, so he doesn't have to worry about it. It moves with him. So it's been, charging has been pretty simple and easy to manage for us.
Amazing. Thank you, Tiffany. Thanks, Brad, for showing that. And like we shared, please do reach out to Romina with additional questions. Please go to the link, direct link for Neuralink registry if you also want to learn more, generally speaking, in addition to being able to connect with Romina directly. And then, of course, Synapticure has neurologists, ALS specialty neurologists, who can talk to you about any trials, any expanded access programs, anything you need. And so if you have a Synapticure physician, talk to them about it. If you want to talk to a physician, we can see you within a few weeks and talk about all the options with you as well. Before or as we close, I know we're already a couple minutes over time, but I do, before we wrap up, want to ask if each of you are able to share what is your hope for the future of this technology, both for yourself potentially and for others. And if you're just able to come off of mute, I'll turn it over to you as we wrap up.
I mean, I think it would be really cool and hopeful to control like a lot of external devices. You know, I used to fly a drone around, and I think it'd be really cool to be able to control that. But honestly, if it just helps one person an iota of a percent, you know, I think it's all worth it for me.
Thank you, Jake.
I am very hopeful for myself and everybody else in the Neuralink Prime study because the nature of the study, we're all in power wheelchairs, and the ability to drive our wheelchairs with a Neuralink is, for me and everybody else who comes after, the level of independence that would buy is nothing short of remarkable. I think that would be absolutely incredible.
Thank you, Nick. Brad and Tiffany, I don't know if you want to weigh in here or whatever you prefer, you can let me know. All right. Let's see. I think Brad and Tiffany were calibrating the screen. If it's possible, Tiffany, to weigh in on the last question, but if not, no worries, whatever you prefer.
Sorry, Brad's trying to convert his speech into his 11 Labs voice because much better in his own voice than in the other one.
I want the speech restoration stuff.
Brad wants another implant so he can have the speech restoration stuff too. Also, like Nick, he wants to control the wheelchair.
Yes.
So he wants a second implant.
Amazing.
Yes. Yes.
Well, thank you. This is a pinch me call. I can't believe. Yes, this is your AI chat, Brad. I've gotten to see it
Yeah.
in motion. What an incredible call.
Oh,
Huge gratitude to the team at Neuralink for inventing this. It blows my mind. As you know, a caregiver with my husband 8 years into ALS, it's been hard for me to not start crying, hearing everything that all of you are sharing. It's extremely emotional to hear how the science has advanced and how this opportunity has opened up your lives. And incredible gratitude to all three of you for being at the forefront of this and for sharing. You are really impacting so many other people and paving a path for hopefully millions to follow. Just like, thank you, thank you, thank you from the bottom of my heart. So
Thank you
Yes.
so much, Sandra.
Thank you.
thank you,
And
everyone.
of course, Brian's story. I just want to share a couple words. Brian's story has been incredibly inspirational to all of us here at Neuralink, as well as myself personally, and watching his documentary, all the work you've done through ALS, Synapticure, within the government. It's incredibly important and moving and necessary. So we're really truly motivated by the work that you guys are doing at Synapticure as well. And hopefully you can continue that for years to come as we all work together to, you know, I want to say attack, but like approach ALS from all different angles, right? So that we can, you know, improve quality of life, hopefully eventually find a cure, and help restore quality of life and autonomy to individuals who lose it through this disease.
Absolutely. Absolutely. 10 million times over. Thank you so much. Thank you to the Neuralink team for bringing this to families and for telling us about the trials. Again, the link to the trials is in the chat. You can reach out directly to Neuralink. You can reach out to a Synapticure physician from our website. And thank you, everybody. We will post this webinar as a recording on social, on our website, to our patient community and beyond. So everything that Nick, Jake, and Brad, you've shared today, and Tiffany, we will make sure to spread it far and wide. Really appreciate it. Thank you, everybody.
Thank you.